Footy player's wife, Taylor Winterstein, feels qualified to dish out advice about vaccination, and the World Health Organization isn't happy about it.
The World Health Organization says it recognises vaccine hesitancy as a risk, with the potential to erode progress that immunisation programs have made globally. Lisa, what are the potential public health impacts of Ms Winterstein's planned workshops?
The impact of anti-vaccination individuals or groups is quite concerning. Their rhetoric is not supported by science, Lisa
Meaning is a technical officer at the World Health Organization at their headquarters in Geneva.
Several months later,
on the 2nd and 3rd of December, the World Health Organization hosted the Global Vaccine Safety Summit. This was also a 20-year anniversary for the Global Advisory Committee on Vaccine Safety. This was all of the heads, the world leaders on vaccine science and safety gathered together in Geneva, Switzerland. Now, they were there to talk about vaccine safety. And I imagine, since the science is settled, it probably should have been a really short and boring conversation, you would think. Luckily for us, they forgot that there were cameras in the room, cameras in the room, cameras in the room. And what I'm about to show you, I believe, proves beyond a shadow of a doubt. I'm not going to ask you to read into science. I'm not going to ask you to have some interpretation of it. You are going to hear from the leading authorities from their own mouths what you've been watching us talk about every single day on the high wire. Here it comes. I don't even know if we will last after this. If they're going to try and stop information, then this is the show that will have to be stopped. I've been saying we're winning, but nothing would prove it more than someone like a head scientist, a head doctor for the World Health Organization at the Summit on Vaccine Safety admitting that. So let us begin. This is Dr. Heidi Larson speaking to all of the scientists in Geneva, Switzerland about vaccine confidence.
You've seen a lot of news about the growing questioning environment, but what I'm trying to look at here is where does safety come up in the broader look at where the confidence problem is. And again, safety rises to the top. This was in the U.S. I've done a lot in Europe. This was our first, we developed a vaccine confidence index, which we've been running for 5 years. Have under review now an analysis of 250,000 people in 148 countries. We have all their background demographics and to look at what are the trends and patterns, but this is one of the first ones we did, 67 countries in 2016, and I was actually surprised at Europe being so acutely skeptical when it came to safety. I knew other countries were having some issues, but it was quite acute in Europe. When we try to disaggregate that by different kinds of reasons, safety is the biggest issue. Safety is the biggest issue. Safety is the biggest issue.
Take a look what she says about the vaccine safety science.
There's a lot of safety science that's needed. And without the good science, we can't have good communication. So although I'm talking about all these other contextual issues and communication issues, it absolutely needs the science as the backbone. You can't repurpose the same old science to make it sound better if you don't have the science, that's relevant to the new problems. So we need much more investment in safety science.
What? Bro, what are you talking about, man? Bro, I'm out, man. It's tripping.
The other thing that's a trend and an issue is not just confidence in providers, but confidence of healthcare providers. We have a very wobbly health professional front line that is starting to question vaccines and the safety of vaccines. That's a huge problem, because to this day, any study I've seen, and we're constantly looking on any studies in this space, still the most trusted person on any study I've seen globally is the healthcare provider. And if we lose that, we're in trouble.
Listen to what she's saying. The front line, they're soldiers for this issue are the doctors. Everybody looks up to, she says, to the doctors. That's the number one person that people believe in, but that person is becoming wobbly. That person, we are all shocked to find, including her, but especially me, that they are starting to question vaccines themselves. The doctors themselves are questioning the vaccines. Isn't that mind-blowing? So we're having an even bigger effect than we realize. They're not admitting that to us, but they're admitting that to the World Health Organization when they're having to fill out a survey. Yeah, no, I'm not really confident about these things. Some of the things like I'm especially not confident giving a flu shot to a pregnant woman because I haven't seen a safety study on that. But what's really amazing is when she starts to drill in on why would the doctors be lacking this confidence and what are we going to have to do about it, listen to what she admits.
We've talked about it earlier. Some of the challenges are when the frontline professionals are starting to question, or they don't feel like they have enough confidence about the safety to stand up to it to the person asking them the questions. I mean, most medical school curriculums, even nursing curriculums, I mean, in medical school, you're lucky if you have a half day, on vaccines, never mind keeping up to date with all this.
I would be asking people who would they trust more with their child, their local doctor or a wag?
What? Wait a minute. I thought Dell was exaggerating. I thought he was spreading misinformation when he said that doctors are barely trained at all in vaccines. I've told you, it's like a paragraph. You're lucky if it's a day. She said, listen to what she said. This is the head investigator looking at vaccine safety, why it's an issue, why are doctors wobbling? Because she says to the whole room. Nobody said, boo, hiss, that's not true. They all nodded as she said, as we know, doctors and even nurses are lucky if they get a half day of education on vaccination. Out of 8 years, we're lucky if they get a half a day of education.
What kind of shit is that?
That's what they all say. We are not educated about vaccines, yet we're telling you it's safe, we're telling you it's effective, but we can't answer any of your questions. And what are they calling that? When I try to bring the news to you, when you start to see gray masks over the videos that we're doing saying this information is not true, you got to go to our fact checkers. How about let the World Health Organization do some fact checking for you, would you? Because this is what they have to say about our misinformation.
I spend a lot of time talking, particularly in the last 6 months, with tech companies, Facebook, WhatsApp, Pulsar, Twitter, Instagram, WeChat, Weibo. They have a lot of fingers pointing at them to fix the misinformation problem. But it's not so simple. One, the biggest problem is a lot of it's not misinformation.
Medical expert John Cunningham.
They're going to be trying to indoctrinate young parents, and particularly mothers, in misinformation.
Wait a minute. Wait a minute. Wait, first of all, you're not going to speed past that like you didn't just say what you just said.
Our problem is, as we've heard in the last 48 hours, that there's not anything 100%. And what actually can legally, without creating a censorship thing, can we absolutely say this is misinformation? Because we have a lot of ambiguity in the safety field, and we have to come to terms with that. So we have to think about it differently than deleting misinformation, but building trust so people are willing to put up with a certain amount of risk because they believe in it enough. They believe in our work, what we're doing, and that it's in their interest.
I'm speechless. I mean, I think you should be speechless right now. These are the people that are writing the mandates. They oversee the AMA, everybody. This is the World Health Organization. These are the world scientists. This is the woman looking into it. And what she's saying is, look, we all have to admit that our biggest problem is these things that are being said in these blogs and these posts online. It's not actually misinformation. Even though we've told CNN to call it misinformation, even though we told the Washington Post and the New York Times to call it misinformation, here inside this room where we forgot the cameras are rolling, we all know deep down it's not misinformation. It's true.
Oh, Hercules, Hercules, Hercules.
I want to show you the video that the World Health Organization put out 4 days before hosting the Vaccine Safety Summit. Take a look at what, once again, they wanted to tell the world outside of this room. Take a look at this.
Vaccines are very safe. If someone gets sick after vaccination, it is usually either a coincidence, an error in administering the vaccine, or very rarely a problem with the vaccine itself. That's why we have vaccine safety systems, robust vaccine safety systems. Vaccines are one of the safest tools we have to prevent disease and ensure a healthy future for all children.
4 to 6 days later.
I think we cannot overemphasize the fact that we really don't have very good safety monitoring systems in many countries, and this adds to the miscommunication and the misapprehensions because we're not able to give clear-cut answers when people ask questions about the deaths that have occurred due to particular vaccine, and this always gets blown up in the media. One should be able to give a very factual account of what exactly has happened and what the cause of deaths are. But in most cases, there's some obfuscation at that level, and therefore there's less and less trust then in the system. Putting in place the mechanisms, whether they're cohort studies or whether they're sentinel surveillance sites, to be able to monitor what's going on and report back, and then for corrective action to be taken, because unexpected things could arise after introduction, and one always has to be prepared. As we've seen, in the history of many drugs, you've learned about adverse events only after the drug's been licensed and introduced into the population. So I think that risk is always there, and the population needs to understand that and feel confident that mechanisms are being put in place to study some of those things.
I cannot believe this shit. Why the fuck you lying? Why you always lying? Oh my God. Stop fucking lying.
Do what it takes.
Taylor, you rock, and you're our high wire hero of the week. What does your husband have to say? Is he like, baby, come on? I mean, honey, you got to get yourself in the middle of this? I mean, he's one of the most powerful guys in the world, yet his wife's out there, and he can't protect you.
No, he's like, baby, go for it. You are so brave. I love how fierce and passionate you are. My husband, I could not do this without him and his love and support. That's one reason why I can be brave and keep going, because I have a man behind me who supports his wife, supports, our decisions. He's so proud of how we raise our children. Our children are so healthy, and he wants to share that with the world too.
Taylor Winterstein is joining me with her husband, Frank Winterstein. First of all, thank you both for coming in here. Has it affected your career at all? I mean, what's it like? I mean, you travel from one team to another. Have you seen anybody mention it to you, or does it come up?
Yeah, definitely. It's been tough personally. Obviously, seeing her being spoken down to in the media and stuff is quite tough. But as a husband and as a father of our kids, I've just got to make sure that I'm on my A game all the time and hold space for her and keep supporting her along this journey, because so many people depend on us. Whereas the teams, I definitely do have conversations with a few of the boys in and around the changing rooms and on the field after a game. They're quite, they want to know what's going on, and they have a few questions to be asked, so they definitely lean upon her and trying to get as much information as possible through Taylor, so she's doing a great job. Your kids are your everything, and for me personally, I'm a husband, I'm a father first and foremost, and my career comes, second to that. So I'd happily just give it all up just to make sure my kids are safe and sound and are healthy. And thankfully, Taylor's leading the way for our household and for many Australians back at home. And I'm just real proud of her. She's flying the flag for us Aussies down under, and I'm definitely gonna keep showing up like this. Here I am, and supporting her all the way.